just give you an overview of what the East Mediterranean region is like, and then we'll delve into the progress made in the implementation of the GICC in the EMR. So we'll just look at the overview, the cancer burden, some of the cancer work, and then look at the progress, and then we shall discuss the way forward, like you said. So the EMR comprises 22 countries, which is covering a vast population of people with areas in the Middle East, in North Africa, in the Horn of Africa and Asia. Population is about 700 million. And now what's unique about the East Mediterranean region is its diversity. So it has both economic and cultural diversity. It has countries ranging from low income countries to very high income countries actually. And also, as you see, the countries represented there, it's very diverse culturally. And what does this mean? This really means that you cannot have a one size fits all. You have to have a tailored approach for the different communities represented. Now, this region is also unique in the way that it is prone to conflict and emergencies. As of 2018, I think out of the over 130 million people living in emergencies, 53% were actually occupying the countries in the East Mediterranean region. And again, out of the about 70 million people in need of aid in 2018, about 46% were in this region. So about half the countries are basically in areas of conflict and emergencies. And this has its problems. There are problems of displacement, there are problems of influx of refugees, and then this comes together with weakened health systems, which really worsens the health problems in the region. The other thing unique about this region is heterogeneous health profiles. It ranges from countries with very good health systems, mature health systems with national policies, down to countries that have no national policies or no public facilities for childhood cancer. So it's a very heterogeneous region. So just a little bit about the overview of cancer burden in the region. The cancer burden it varies from about 76 to 243 per 100,000, but this number is predicted to double by 2030. And in 2018, a total of 676,000 new cases of cancers were seen, with the death of over 400,000. But again, the cases seen in 2018 are predicted to double by 2040 if nothing is done in terms of early detection and prevention. And the cancer burden in this region is actually quite big. It's the fourth leading cause of death in the region, but the second cause of NCD-related death. In 2016, death due to cancer contributed to almost a quarter of the NCD-related premature deaths. So the capacity of health capacity to handle cancer in the region, again, like I said, it's a very heterogeneous region, but there are certain cross-cutting challenges, and I've just highlighted the challenges. When we look at the issues of data, looking at the population-based registries, only 29% have actually high-quality population-based registries. So it's hard to have even data for planning in this region. And when we look at the quality of mortality registration, between 2007 and 2016, there was no country with high-quality coverage. But to note, the ministries of health, in the ministries of health, 81% of the countries have actually Ministry of Health staff who are dedicated, who have dedicated time to deal with the issues related to cancer. Now, just to emphasize the heterogeneity in terms of the health in these countries, when you look at, say, the workforce, the median number of surgeons is 338, but you see per 10,000 cancer patients, but you see it ranges anywhere from 15 to almost 2,000 per 10,000 cancer patients across the region. So the facilities may be there, but are not evenly distributed across the region. Again, in terms of governance, we all know that health governance is one of the key issues for success in any kind of health program. And when we look at issues of governance, like the NCD plan 67% of the countries have operational NCD plan, but only 48% have operational cancer plans. And the public centers for childhood cancer actually range from countries like Pakistan that have no cancer center or no public cancer center to certain countries that have up to 44 cancer centers per 10,000 cancer patients. And for the early detection programs, only 10% of the countries have for breast cancer, cervical cancer, colon cancer, and childhood cancer. But there are certain nice things about this region as well. You have 33% of the countries having capacity to do bone marrow transplants, 90% of the countries having pathology services, and 76% of the countries having cancer guidelines. But again, you realize that things like palliative care that are very vital in childhood cancer, I mean in cancer in general, is really having poor coverage. So like I said earlier, there are challenges in implementation of the child cancer plans that I have mentioned, and there are also the shortfalls in cancer management in the region. So in response to the World Health Assembly resolution, the 70th World Health Assembly resolution, the region developed the framework for action for cancer, which basically covers 6 areas of governance, prevention, early detection, management, palliative care, surveillance, and research. And each of these areas has some strategic indicators, and I mean strategic interventions and indicators. There are 26 strategic interventions and 20 monitoring indicators. And this framework aligns very nicely with the GICC in the areas of governance, in the areas of prevention, detection, treatment, in all the areas. It aligns nicely with the GICC and the other global initiatives like the breast cancer initiative that is going to be launched very soon. So this is kind of like a regional roadmap towards the addressing cancer in the region. So on childhood cancer in the EMR, there's actually very limited data in the region on childhood cancer. But as of 2020, the childhood cancer incidence was 33,000. And childhood cancer is the 3rd leading cause of death, and that is after injuries and violence. And but like we saw in the previous charts, we have just about 10% of the countries having early detection programs, and only 38% of the countries having defined referral system. On the left of the slide is the really distribution of childhood cancer in the age group of 0 to 14 years, with the ALL, acute lymphoblastic leukemia, being the most common cancer, followed by Wilms tumor, and then the other tumors. So on the global initiative for childhood cancer, I think the CCI is not unfamiliar with this. The goal is by 2030 to achieve at least 60% survival for childhood cancer, with the objectives of increasing capacity for countries to provide quality services, and then increasing prioritization of childhood cancer. So at a regional level, basically we're supposed to do regional assessments, dialogue, snapshots, and policy briefs, and the activities that are supposed to be done at both national and global levels as well. And to guide the implementation of the global initiative of childhood cancer, there is the Cure-All technical package and the Cure-All framework that has these 4 pillars and 3 enablers: the Centers for Excellence, universal health coverage regimens for management and evaluation, and then the advocacy, leveraging financing, and linked policies. So the rest of my presentation is basically going to be around the global initiative of childhood cancer. So what has the East Mediterranean region done so far? So at a regional level, we have done a situation analysis, and what we have so far is just a snapshot analysis, but this is going to be complemented by a comprehensive analysis that using the Cure-All tools that are yet to be released. So the snapshot survey was really done in conjunction with the ministries of health of the different countries, where we approach the focal points with questions covering the different domains of the Cure-All. And we were able to come up to look at some of the challenges and some of the opportunities. And what was interesting, we had at least most of the member states, 80% of the respondent member states reported having childcare centers, ranging really from small departments in general hospitals to dedicated child cancer centers. And we also looked at the partners in the region, and there were over 75 partners in the region. And I must say most of these partners are CCI members. And but of course, there were challenges in areas of governance where only 2 countries reported having childhood cancer action plans. Actually, most of them had cancer strategies with childhood cancer embedded, but just 2 countries had childhood cancer action plans. And then, of course, there are areas of service delivery, inadequate human resource, and inadequate surveillance and quality assurance. But there were also some great opportunities in this region, like the government commitment. Most of them had childhood cancer actually in their universal healthcare benefit packages. There were a number of care centers for childhood cancer. And even in areas where childhood cancer wasn't covered in the universal healthcare package, childhood cancer was actually treated in public centers free of charge by the government. The fellowship programs in the region. And at the end of the day, when we looked at the priority areas for childhood cancer, we actually discovered that the priority areas in this region, which included things like national guidelines, improving access to medicines, health workforce, establishment of child cancer registries, all aligned with the GICC. So it's going to be easy to implement if we look at the priority areas aligning with the GICC. The region has also done a stakeholder mapping, and this was really done in preparation for forming a regional alliance or a regional network to guide and support the activity of the implementation of the GICC in the region. There are 28 partners active in the region, and like I just mentioned earlier, most of the partners were actually CCI members. And so we looked at the regional presence, we looked at the focal points, and then we looked at the scope of activities that range from advocacy, capacity building, clinical management, resource mobilization. And we also looked at their global collaborations and networks. And these results, the results of this stakeholder mapping are going to be disseminated. So we shall be reaching out to you again with an email for the dissemination of these results, and for really discussing the governance structure and also calling for declaration of interest. So we also have had dialogues in the region. We've had both regional dialogues and national dialogues. We had the virtual consultation on the GICC on the 25th and 26th of January. This brought over 100 participants from all over the place. And the member states, the UN agencies, professional associations, and the partners in the region. And we had great discussion during this dialogue. And we also, following that, we had again another dialogue with the experts, where we had again great participation of about 70 members. And we just discussed childhood cancer in the region and some of the way forward from the previous meeting and the cure-all technical package. We've also, the region is also supporting national dialogues in Morocco, Pakistan, Palestine, that have happened last year and this year as well. And then we also had campaigns. We've also had cure-all campaigns. We call them the cure-all campaigns. And these campaigns really happened around the celebration of the International Childhood Cancer Day. We had a virtual screening of a documentary on childhood cancer that saw the stories of 4 children with childhood cancer from 5 regions of the world, including the East Mediterranean region. And this is really what led to the dialogue with the experts. And to continue with these cure-all campaigns, we are doing cartoon episodes on communication of children with cancer. This is a story of Wasim, a 6-year-old boy who gets diagnosed with leukemia. So the cartoon tells his story from the time he gets symptoms down to the time he goes into maintenance treatment. And this slide has the link and a bit of the teaser from this cartoon. So we have a couple of minutes left. Yes, I have a couple of slides. I'll be faster. So another area is establishing the regional governance, which is very important for the success of the GICC in the region. And the rationale really is to support the regional rollout of the GICC, to provide a platform to engage member states to encourage collaboration and to create linkages with global structures. That's why we did that stakeholder mapping. So consultations on the different partnership models and the terms of reference are still ongoing, and this should be concluded in the next couple of weeks before we call for that meeting. Now, one of the things the East Mediterranean region has decided to do is to go for the blended approach to the GICC. So there is the sequential approach where Morocco was the first focus country, and then we're planning to go on to Pakistan and then Palestine. But there is, after looking at the heterogeneity of this region with the different levels of health system maturation, the region thought that maybe having a blended approach of also going the sequential way, but also involving all member states at the same time, in terms of sending out a call for proposal and supporting the different cancer activities in the different member states, even if they have not reached the health system maturation that is needed to be a focus country for the GICC. So we give two case studies of Morocco and Pakistan. So Morocco has strong political commitment. It has had its National Cancer Action Plan for a while, and it has made remarkable progress in implementation of the GICC, and now it has a childhood cancer action plan. While Pakistan, with a big population of over 200 million, has no public cancer center and no cancer guidelines, but of recent has shown interest in including cancer in the universal health benefit package, and also has insurance that really takes care of the underprivileged, including inpatient care for cancer. So this is one of the ways to do the blended approach, to go with the sequential way, but also to support countries who are coming up with the childhood cancer activities. And lastly, we are doing, so this is a call for proposals, is one of the ways to initiate this blended approach. And the idea behind the call for proposals is really to encourage all member states to come on board and take action and provide funding, to take advantage of the funding that's available. And we are encouraging participation at national level by asking members to have endorsement or approval from their ministries of health before the proposals are handed in. And then we are also asking members to work with the expertise and the partners in the region so that we leverage this expertise throughout the regional network. And the principles for the project proposals basically is to be in line with the GICC, to draw from the priority areas, to be linked with the country national cancer agenda where applicable, and to show ability for concrete impact. So in conclusion, through the implementation of the GICC, we have seen that political commitment is really key in the success and sustainability of any initiative, and hence we encourage this. And integrating childhood cancer within the SDGs, the Universal Health Benefit Packages, the NCD agenda, is really an opportunity to build stronger and more resilient health systems. We also noticed that there's a multitude of partners through our stakeholder mapping throughout the region, and this could be leveraged to support the GICC implementation. And also we are establishing regional governance to establish an